Bonjour and hello, everyone. This is Shahir Sheikh, and we are back. Actually, it's the Three Musketeers, if I can call us that. We're back with another episode of the LARVOL Oncology Podcast. It's a little different this time. We, of course, have Bruno Larval standing on it looks like a usual street. You can tell me where exactly that is. But yeah, and thank you very much for joining us, Daniel.
Very happy to be here again, again
Uh,
and again and again.
so it's a bit of a tradition being on Times Square. When I travel to New York City, we try to rent this billboard here behind me. You can see it. Yes, this one with Times Square on it. And what we do
Okay.
is that we post on it important messages for us. Now, sometimes it's cancer voices, such as the key opinion leaders. Sometimes it's cancer advocates. That'll be the case today. Sometimes it's people we're working with. And I hope I'm not making a mistake. You both have been on that billboard. Is that right?
Yes, I
Yes.
wasn't aware, but I was sent a picture.
You were not aware. Uh,
I was
so
not aware that my face was going to be seen by a couple of
It was
million people.
probably a surprise, Daniel. Somebody planned it.
Well, that's a bit of a breach of GDPR, I guess. If we didn't ask for your permission, you might
Is
have a
it?
case to force
Is
us
it?
to do
For real?
remedial. Yeah, without his permission, we
Yes.
put his likeness on Times Square. It's a problem, right? Under European law, we are maybe in trouble. Okay, but
Well,
so
thankfully, I don't live in
you,
Europe,
kn-
so you're fine.
right. So I want to say a few things ahead of the billboard starting. And tell me when it's about to start. And I want also to make sure I show it
One
properly.
minute.
I'm going to get closer, right? I want to say a few things about these times, who we have and why on the billboard. Okay. So first, we will have several members of the Larval team, and we will acknowledge their successors this year, right? So the Tiger of the Month, as we call them, they will be on the billboard. And in many cases, it's a big deal, right? To be on Times Square is a big deal. So that's one thing. And then we will acknowledge our dear friend, Frank Gallagher, who I met at several cancer conferences. She's oh, here we are. Here we are. That's us. Larval. Okay, that's us. And that's Frank over there and her dog. And that's the tigers that we wanted to acknowledge. So it was very fast, but you just saw it. And
It
we'll
keeps
see.
going on like
It,
several
it might
times a
loop
day.
a second time.
Yeah,
Sometimes it
might.
loops two times in a row, but this time it came. So that was very fast. But you saw it. You saw it live. I might stop by later on during the day. But let me take a little bit of more relaxed time then to explain something about Frank Gallagher in particular. So Frank is a patient, a cancer patient, and she's been an advocate in cancer, a patient voice for many years. Okay. What is so special about Frank? She's been active on social media, by the way, and a few months ago, she sent a message saying she decided to focus on the time she had, and also she decided to stop podcasting and to stop YouTube video. And she one thing that always impressed me so much about Fong, and Fong, if you see her, by the way, hello. I know she's homebound and bedbound, but what also always impressed me so much is her courage and her grace, positive voice, and it takes so much. I think when you face uh, such a challenging and dramatic health situation, to stay with grace and to be courageous and to enjoy the time you have with your family, with your friends, and to project a message of hope and positivity to other patients, and frankly also to people like us who are in the business, from our perspective at LARVOL, in supporting the cancer community and the cancer research community. So I'll let the two of you share a few words as well, but I wanted to say that about Fong and about what we do.
I appreciate the kind words that you just mentioned, and I know that it takes a lot to actually spread awareness the way that Fong has been doing it. So we're grateful for that, and I hope that everything stays well as it can be. Um, Appreciate everything that you just mentioned, Bruno. I really do want to touch a little bit on ASCO, and I do know that Daniel, you have a lot of
I,
things
I
to say on that.
actually, we'll get to that in just a second. I've got one more comment to make about our billboard. We I'm thinking about someone in particular with a very private person who recently passed away. I won't mention his name, both for his family and because of the private nature of who he is. But a dear friend passed away recently, and it affected me, and I know many other people, including both of you. And I want to say that we all touched by this terrible disease, and we play a different role in supporting it. But we certainly think about all the patients. It's easy sometimes when you are in when your business is about cancer to think about it just as a business or just as data. And obviously, we cannot and we should not do that. Occasionally, we forget how human the cost of that disease is. And so both Fong and our other friend are part of that reality, that humanity of cancer. So I wanted to say that. I'm going to pass the baton now to Danielle, who is going to talk about the biggest event of the year in cancer, which is ASCO. We're heading to ASCO in a few days. And he's going to tell you, I'm going to stay mostly on mute, but he's going to tell you how at LARVOL we are supporting with data people going to a conference like ASCO.
All right. So
As you do that, Daniel, I see paparazzi in the background. Very cool.
That's my wife.
I didn't want to make a Borat reference, but you could have. All right. So basically, we've got a platform that's like the Google Maps of cancer, and we've shown it on here multiple times, and I just want to revisit it to show you kind of what the pre-conference buzz is for ASCO. ASCO, being ASCO, gets a lot of noise, right? A lot of noise. There's going to be 1,700 abstracts presented. LBAs haven't come out yet. Those are going to come out in the next couple of days, right? And we can kind of start seeing where the buzz is, right? For number of tweets, we can see SARC041, right over here. You know, we're starting to get some strongly positive things that are saying that for this trial. Let me see what this trial's on. Right, sarcoma. Seems like a phase 3, so it seems like we're going to get the first. It's an LBA. We're going to get the first results for this trial out. Very exciting, right? Harmony 6, of course. Proteus.
What's the buzz for Harmony 6 so far? Maybe let's look at Harmony 6 and how much buzz, how many comments, and okay.
So there's around 17 tweets for Harmony 6. Most of them are neutral, so it's just announcement tweets. 111,000 views in total for them. And if I were Lily, I'd be very excited. You see, Dr. Desai is announcing that they're going to be this could be a game changer. Right? So this is all hypotheticals for now. And then we see also just like a general excitement tweets of this is what I'm looking for in this space, right? So for ASCO, the abstract titles are out. This is what's going on. And the lung space, of course, gets a lot of buzz. We can see Harmony 6 in here, Proteus, and I'm sure J&J will also present some more lung stuff that might come as a later breaking abstract. But this is a very, very good place to get a feel for what's going on at the conference, what's being said, and how that affects your business, your practice, your company, your drugs, and your competitors, and everything, right? This is updated, close to live. End of the day, we have this updates out for you. You can come into the platform and you can see who's been saying what the general kind of feel for it is. Whether you're attending ASCO or not, you can log into this page and kind of get a feel for it. What happened that day at the conference without having to attend, right? What's good, what's bad, and what general sentiment is for everything. And also, if you're trying to understand kind of what will be presented compared to previous years, you can also do that on here, like diagnostic by abstracts, genes by abstracts, right? Drugs by abstracts, of course, Pembro takes the case as always. MOAs, conditions. And it's a one-stop shop for you to put together your reports to what happened regarding your company and what happened regarding your competitors.
Very cool. A quick question, Daniel, if that's okay. So there were multiple analytics that we actually were able to review on the last page. What are the few that actually should be focused at? If there's somebody that's looking at and trying to get into that, get a good idea of the buzz.
It depends. I feel like top trials by X posts and then also influencer posts, like this heat map. So these two, right? Top trials by X posts and then the influencer heat map gives you a good idea of what the data released and what the sentiment for it is. And then who is saying what about what, right? So what people are saying, what kind of how their comments are spread around the industry. So we might see that some KOLs are more broad and they're going to be mentioning stuff around the whole entirety of cancer. And then we might see some that are just focused on their area. And then some that maybe have stronger comments towards some companies than others. And that's important for you to know.
It's very useful. Would you yourself be at ASCO?
Sadly, I'm going to have to pass this year. I have a very strong commitment to voting in Colombia. So I'm missing ASCO for the sake of democracy.
So Bruno's at ASCO. And Bruno, you're muted.
Can you hear me? Yeah. I will be there. Judith will be there. And actually, Bradlen, my son Bradlen will be with us. So 3 people from LARVOL will be represented at ASCO. And
You're going to have them wear purple?
Oh no, that's I don't. They can, but that's fully optional.
Mandatory. It's almost mandatory.
No, it's not. No, it's not. For me, it is. For me, it is not for others. So if you're at ASCO, look for the purple guy, right? Yeah. If you see anybody wearing purple out there, it's me. And the same way, here we've got the naked cowboy on Times Square. Who is fully branded here. And obviously, it's a bit of a misnomer. He is not a real cowboy and he's not naked. But I'm going to be purple and I'm going to be at ASCO. So that's the idea. I know it's a little bit odd to end up with a naked cowboy in the background here, but that's just the way we're going to end the podcast today.
Thank you very much for that, Bruno. Not the naked cowboy, but everything else that was there. Appreciate it. Thank you very much, Daniel, for joining us. Thank you, Bruno, again for actually tuning in live from the Times Square. I'll let you close, Daniel. Anything as we go out?
Onwards and upwards, and don't eat yellow snow.
Au revoir.
Au revoir.